Hello everyone and welcome to this Bright Blue event in partnership with Impact on Urban Health titled A Breath of Fresh Air, Fair Affordable Solutions for a Public Health Crisis. My name is Ioana and I'll be chairing today's event. I am a researcher at Bright Blue, which is an independent think tank and pressure group for liberal conservatism. We have 7 major research themes, which are bountiful economy, clean environment, good lives, rewarding work, empowering government, just institutions, and connected communities. Please tweet about the event using hashtag #BrightBlue and hashtag CPC22 and follow our account at WeAreBrightBlue. Now, in a moment, we are going to hear from our 4 speakers, who are Alexander Stafford MP, Rosamund Kissi-Debrah, Councillor Jo Porter, and Kate Langford. Alexander Stafford is the Conservative MP for Rother Valley and a member of the Business, Energy and Industrial Strategy Committee. Rosamund Kissi-Debrah is the co-founder of the Roberta Family Foundation and a British grassroots campaigner who raises awareness of asthma and the health problems that can be caused by air pollution. Councillor Jo Porter is a Conservative councillor and cabinet member for climate change and biodiversity at the Staffordshire Moorlands District Council. Kate Langford is the programme director for the Health Effects of Air Pollution programme at the Impact on Urban Health. The topics we will explore in this discussion include what the health, economic and environmental effects of air pollution are, what people living in more deprived areas think about air pollution, how effective existing measures to tackle air pollution have been, and what further measures are needed to curb air pollution whilst not penalising the poorest in society. Now, each speaker will speak for about 5 minutes before we open up to an audience Q&A. If you're watching this event online, you can ask questions through the Slido link located next to or below the video player. So without further ado, I'm now going to pass over to Alexander Stafford.
Well, thank you very much indeed, everyone, for being here today. And obviously, this is a topic that is close to my heart, not only as a member of the Base Select Committee, but also as chair of the Health and Natural Environment All-Party Parliamentary Group, where we look at the intersection between people's health and environment in which we live. I also want to say I'm just the newly appointed Vice Chairman for Policy, so anything I'm saying today isn't actually Conservative policy, but just my thoughts, so please don't quote me on any of this, well, in a Conservative policy way. Why I'm particularly interested about this is that there's significant inequality of access for nature and clean air. About 1/3 of the UK population accounts for 80% of all visits taken, and almost 3 million people do not live within a 10-minute walk of a green space. People from low-income households are about 25% less likely to live within a 5-minute walk of a green space, and someone from a black, Asian, or minority ethnic background is nearly 4 times likely as a white person to have no access to outdoor space at home. So clearly, we have a big disparity between parts of the population and access to clean, green spaces, and that's a huge problem. And we're seeing that this affects on our children, and the fact they're not spending enough time outdoor, and those times they do spend outdoors are not in that clean air environments we want them to. But when we talk about health, and of course the panel is going to talk about clean air, we should also look at the evidence, as data indicates that people who visit nature regularly feel their lives are more worthwhile. There are links between a greener living environment and higher life satisfaction, including improved mental health and reduced stress, fatigue, anxiety and depression, along with those obviously physical issues that I'm sure we all know about, carbon monoxide and nitrous oxide and the likes. People who visit nature at least once a week are almost twice as likely to report good general health. And however, it is individuals' feelings of connectedness with nature that are important for their well-being. When controlled for time spent outside, people with high nature connectedness are almost twice as likely to report their lives are more worthwhile. And we've seen the importance of green spaces more recently during the pandemic, where 43% of adults in recent surveys said that visiting green spaces has been even more important for their well-being. On top of this, there is evidence that is good value for money for the government as well to invest in green spaces. For example, we are here in Birmingham after all. Birmingham has a citywide Be Active programme, found that approximately £23 was recouped for every £1 spent on green spaces, which in other words means for every £1 Birmingham City Council spent on improving green spaces, they got back £23 in things like lower health and social care costs. So that is a huge return on investment. So what is the current government doing about it? And obviously I want to caveat everything, we are in a new government world at the moment, so some of these things may not be relevant, but I'm sure we'll see in the coming days and months what's going to happen. But significantly, since 2010, air quality has improved. Emissions of nitrogen dioxide have fallen by 44%, sulfur emissions have fallen by 70%, and fine particulate matter have fallen by 18%. The Environment Act of 2021 includes long-term environmental targets, including a maximum annual mean concentration for fine particulate matter, which will help with air pollution. But we also must look at the macro elements as well, looking at the phase-out of a sale of polluting solid fuels, such as wet fuel, bituminous coal, and high-sulfur manufactured solid fuels for domestic burning. Furthermore, the government's clean air strategy aims to halve the harm to human health caused by air pollution by 2030, which will reduce the incidence of serious illness and improve the quality of life for tens of thousands of people. So we are going in the right direction, but it's important that we go further. And it's not just about physical health, it's also about mental health. And I think that's something we, the panel, should also be looking at today and discussing, about the connectedness to nature, trying to get people out into green spaces, but also when they are out in those green spaces, they have cleaner, greener air. But it also ties into our green energy future, so new forms of energy, such as hydrogen, offshore wind, solar, and our pivot away from fossil fuels will not only give us a greener future, but a healthier future for all. Thank you.
Thank you, Alexander. I'm now going to pass over to Rosamund Kissi-Debrah.
Hello, and thank you for sparing the time to come here and listen to us. Listening to Alexander, I actually asked myself, why should I be here? Because obviously there doesn't appear to be a problem. It's all going very well. Unfortunately, there is another side to this. And I think the nation will be quite surprised very soon when Chris Whitty's report comes out about the impact of air pollution on health. It even starts before children are actually born. When you come to these things, you can sometimes sit there and think everything is okay. And when they churn out these figures, it sounds fantastic and wonderful. However, the reality is very different. Scientists have now found a direct link between air pollution and lung cancer. And in London, Jonathan Grigg has found that some of the dirty air is equivalent to inhaling or passive smoking 15 to 20 cigarettes daily. So no wonder there's a crisis. If you think I'm lying, just go to any hospital in London and there you'll see the evidence. When I started on this journey, I thought if you show the government the research, they will actually do something about it. What am I nervous about right now? The government are going to set targets that need to be done by the 31st of October, and I don't have any evidence or any confidence that much is going to change. What I try and do is raise awareness. So our main illnesses, cardiovascular, strokes, diabetes, cancer, everything is linked to air pollution. A lot of people, so I actually walked around outside when I got here and people were talking about 2050, decarbonisation, 2040. A lot of people, especially poorer people, they aren't going to make it. And that is the honest truth. Do you know what? It tells me a lot about our society if we don't care about those, the most vulnerable. And the fact that in 2022, children continue to die of asthma, who are linked to air pollution. Since my daughter died, about coming up to 10 years, the minimum number of children who have died in London is 80. The only time children didn't die, guess when that happened? During the pandemic, when there were no lorries on the road or vehicles of any sort. It is the only time in the UK that no child has continued to die from asthma. The figures are horrendous. There's an inequality that Alexander has already mentioned. And we keep on churning out these figures, but my point is, what are we doing about it? When I go around communities, when I look around, not much is changing. A lot of them don't engage in the political process because they think people really don't care about them. And walking around now, it's like being in a completely different world, seriously, being at this conference. And I'll just hop on a train and get back home and it's completely... I still live near the South Circular. And roughly about 14 hours a day, there's gridlock traffic. But that's not the only place. Look, this morning, I actually woke up to hear Will Norman, and I can quote him, and he can respond if he wants. And he said, the air is cleaner than ever before. Well, my response to him is the coroner in my late daughter's case said the monitoring is woeful. And one thing to let the panel know is the nanoparticles, the really, really tiny particles that get into the bloodstream, there is no monitoring for it. So I am suspicious about the monitoring, and we proved in court it is woeful. You are in a position that you can put the pressure on the government. I'm not talking about climate change in 10, 11, 20 years. I'm talking about now, that people are dying every day prematurely. So that's why I have come from London to speak to you, to put pressure on MPs to do something about this. I think they talk the talk, but when it comes down to it, not much is changing. Let's look at COVID. And the actual research hasn't come out, but in time there'll be loads of research. You know, research into COVID is going to go on for years and years to come. So we all saw at one point, didn't we, that black and brown people were 4 times more likely going to die, and there was all this panic suddenly about it. And I remember talking to scientists about this, and I said to them, look, we live in a city that people are breathing in filthy air every day, which means their immune system is compromised. So if you suddenly put a respiratory virus in there, what do you think is going to happen? And they know what I know. Or there was the situation with bus drivers. Remember, a lot of bus drivers kept on dying. So one of the things I actually asked them, how long have these bus drivers been driving their buses for? And if it was anything over 5 years, they had been inhaling all those diesel particles. As a society, all I'm asking is we need to care about those who are vulnerable. We can't live in a society that children, every year in London, up to 12 children die from asthma. Around the UK, it is between 20 and 24. But the health impacts are quite shocking. And there is a disparity. Maybe it's not people around here or who are here that need to care about it. But I think it's something we all need to look at. You know, we've all had heat or eat. And I think my concern recently has been talk of fracking. And I've been over to the US, Texas, where they actually do a lot of fracking. And I've been invited back to... Just 1 second. I've just been asked to, you know, we talk about fracking as if that is the solution. When you look at states like Texas, they've got a cloud of air pollution over it. It is not the solution, but we need to care more. We need to have more compassion and empathy for those that can't be here in this room right now. Thank you.
Thank you, Rosamund. I'm now going to pass over to Councillor Joe Porter.
Thank you very much, and thank you to all of you for attending today. All of us across the country face issues when it comes to air pollution. It affects every single one of us, and we know that air pollution is the leading environmental threat to human health here in the UK and around the world, and it particularly affects childhood development, and we know that it affects lung development in particular, and obviously lots of other health issues. So it's something that affects all of us, and we know that when you have cleaner air, it means that you have greener, cleaner and healthier communities, and that people live more happy, fulfilling lives. So that's why this is such an important issue, and we know that it has a huge cost to the UK economy. So here in the UK, it has an annual cost of £1.7 billion a year to the economy, so it is an important economic issue as well. And I suppose as a local council, as the councillor on the panel, my perspective is that the best solutions lie in local communities, because all of us across the country, we all live in lots of different communities, whether urban or rural, and air pollution will affect us in all different ways, and so we need those unique local solutions that work for our areas. So we know, for example, that there have been some parts of the country that have gone down the path of clean air zones. Whether you agree with them or not, they're the path that some have chosen to go down. Other areas have chosen to go for other schemes, like low emission streets, for example. So everyone's got all sorts of different solutions to this. And in Staffordshire, we have our own solutions. I mean, in Staffordshire, on average, air pollution causes 390 deaths a year in Staffordshire alone. So that's the local context in Staffordshire, and we are a very rural area. I mean, in our case, the main cause of air pollution is traffic, like a lot of other areas. So we have key areas where there's large concentrations of traffic. So in the Staffordshire Moorlands, we've got Leek, Biddulph and Cheadle as our main towns. We've got lots of villages. So our two key hotspots are Leek and Cllr Head, where we've got huge traffic flow issues. And I suppose the second cause is agriculture, because agriculture is a very important industry locally, but it does cause a lot of air pollution as well. So again, it's about working with the farmers, trying to have a business friendly approach that obviously helps farmers with that transition to trying to improve air quality. But yeah, and the other problem that we have in our area is we still have a lot of people that burn domestic wood, because we're a rural area. We've got a lot of rural villages, a lot of elderly people that get cold in winter, and that is going to be a huge challenge for the government and for us as a party, because we have got a lot of elderly voters that we want to help, we want to protect, and as councillors we represent a lot of elderly constituents who we don't want going cold in the winter. And there's still a lot of domestic burning, and they reckon that domestic wood burning is responsible for 2/5 of the most serious air pollution here in the UK. And so we've got to try and find a way of making it both easier and cheaper for people to make that transition to electric fuel, to electric heating, and that's not going to be easy, because people have been used to that set way of doing things. People are used to using domestic wood, so it's very difficult for us to persuade people. So that is going to be a huge challenge for us across the country. But one thing I did want to just touch on is, so in Staffordshire, we have had a fantastic county-wide campaign called Air Aware Staffordshire, where all of the councils, the county council and all the district and borough councils have all collaborated together, and we were awarded a load of money from a DEFRA grant to set up Air Aware Staffordshire. And what the campaign does, works with schools, works with businesses, works with communities to come up with unique solutions for those individual communities to air quality issues. And they've done some fantastic work around the schools, because obviously we know, around schools, at school time, it's always a huge issue, air pollution is, because it has a huge impact on young children and families. And what they've done is they've had very targeted air quality campaigns, things like school assemblies, active travel campaigns, provision for walking bus coordinators. So we have like a walking bus scheme where we encourage the children to walk to school in groups, and we have like volunteer network for that, and things like anti-idling campaigns, because a lot of parents keep their engines switched on, sadly, particularly during the colder months, and they don't always realise that by keeping their engine switched on, that they're directly damaging their children's health. So the key thing is we've got to educate people, and we've got to take people with us on this journey. And I suppose, in conclusion, I think air pollution, it's a very complex issue. It affects all of us, as I say. But I think what we've got to do, if we want to be successful with trying to reduce air pollution, trying to improve air quality, we've got to have solutions that take people with us and that respect local solutions, things that are going to be unique to those local areas. We can't have a one-size-fits-all solution to this across the country, and I think it's really important that we have that constant engagement and education with people across the country if we want to have greener, cleaner and healthier communities.
Thank you, Joe. I'm now going to pass over to Kate Langford.
Thank you so much to all the other panellists. I'm Kate Langford. I'm Programme Director, Impact on Urban Health. We're a London-based independent foundation working to tackle health inequalities that are disproportionately impacting people living in inner city areas. Air pollution is one of our 4 main priority areas, and I'm lucky enough to lead a 10-year programme where we're funding a whole range of work to try and tackle air pollution in South London. First of all, I just wanted to echo what I think most of the other speakers have so eloquently put about the harms of air pollution to our health. So every year, 36,000 deaths across the country are associated with air pollution, 4,000 of which are in London. But it's not just a London issue. Air pollution affects every big city around the UK. there is more growing evidence around how air pollution affects a whole range of conditions. As Rosamund talked to, even before you're born, it's associated with low birth weight, high rates of stillbirths. When you're growing up, it's associated with decreased lung function in children. So children growing up in polluted parts of areas have decreased lung function, which is the equivalent of 2 eggs missing from their lungs. And then when you get into old age, it's associated with diseases like dementia and Parkinson's. And it's not just these kind of long-term conditions. For people with respiratory conditions, it impacts people's everyday lives. It impacts on where you can live. It impacts on where you can go to school. So we don't just hear about people talking about long-term health ramifications. We hear about impacting people here and now. And I guess the second thing that I wanted to say is that air pollution affects people who are often those who are least contributing to it. So when you look at who is living with highest levels of air pollution in their communities, it's often people who aren't driving a car. They don't have a wood burner, especially in inner city areas. They aren't the ones who are contributing to this problem, but they're the ones whose health is affected by it. And they're the ones who often can't choose what to do about it. They can't just up and move. They can't just choose to move to a greener, leafier area. They need environments which are more supportive of their health. They shouldn't have to make a choice about whether they breathe in dirty air every time they go out of the house. And I guess, so we at Impact on Urban Health, we are trying to look for solutions and fund work which reduces the harmful impact of air pollution on people's health, but in a fair and equitable way. So, I think we've all heard about policies and initiatives over the last couple of years that have been divisive, that there is a concern that the people who are paying for those policies are people who are poorest, living on the lowest incomes. We're looking for fair, equitable solutions to the air pollution crisis. And I think the thing that does hearten me, despite, as Rosamund says, it's often quite a bleak area to work in, and it can feel quite hopeless, but the thing that I find really heartening is the solutions that actually, whether it's at a local government level, as Jo spoke to, or businesses come up with. And I'm lucky in my position to hear those solutions every day. So locally where I work in Lambeth and Southwark, there's a group of businesses that are working to shift more deliveries for that last mile delivery onto cargo bikes. They say that these businesses are finding that it is faster, cleaner, and cheaper doing those last mile deliveries on cargo bikes. So there's ways that this can be a win-win for business. It's not just about penalising businesses. We've also been working with local construction companies to try and reduce construction-related pollution. We often think just about pollution coming from traffic, but actually 30% of particulate matter 10, so the larger type of pollution, comes from construction in our boroughs in Lambeth and Southwark. So we've been working with construction sites developers who are actually really excited about the challenge of how can we reduce emissions from our sites? How can we do this so it reduces our fuel costs? How can we do this so that it improves health for construction workers? How can we do it so that it improves health for local surrounding communities, both health and noise and the impact of having a local construction site around them? So they're coming to us saying, we think that we can decrease emissions from our sites by up to 20% if we prioritise clean technology for those sites. So there are lots of examples of businesses and local government, as Jo spoke to, trying new things, trying new policies. It isn't all doom and gloom. And I guess the last thing that I wanted to say before we open up is it can feel like an intractable problem. But we do have really good evidence to suggest that we can reduce air pollution down to at least the levels that the World Health Organization said are kind of the interim levels that we should be aiming for. And we have evidence that we can do that quite quickly by 2030. So Imperial College London, who are one of the most world-leading sets of academics looking at air pollution, published a report last year which showed that we could reduce air pollution levels to those WHO interim targets by 2030 if we just implement the existing policies that we have committed to and that this can the previous Conservative government committed to. So it is within our grasp, and actually I've worked on health inequality issues for the last 15 years, and it's very rare that you can think about actually removing one of the biggest environmental health risk factors just completely. It's a solvable problem if we work together, government, business and local communities.
Thank you, Kate, and thank you to all our panellists for your speeches. We are now going to open up to an audience Q&A. A reminder that if you're watching at home, you can ask questions through the Slido link located next to or below the video player. But I'm going to take questions from the audience in the room first. Before you speak, please state your name and the organisation you are from, and wait for the microphone to reach you so that those watching at home can hear you. So who's doing the mic? Yeah, I'll take a question from that gentleman over there.
Thanks, everyone. My name's Sean Walsh. I'm from Cancer Research UK. Very quickly, Rosamund, thank you for citing the links with lung cancer. I think that the study you cited was part of our TracerX lung study, which is a £40 million research programme at the Francis Crick trying to understand the causes of lung cancer. You know, I think this, alongside smoking, sits in a space where we can take preventable action. We can do something to address this, both locally and nationally. And I guess my question is that, and I'd welcome some honest reflections from people, if possible, about, we read last week that the health disparities white paper is potentially being parked. This felt like an opportunity to take a cross-government approach to how we prevent air, tobacco, other conditions that we know are so damaging to people's health. And I wanted to understand what people's reaction to that was and what they might expect of the new administration in trying to tackle this. Sorry, that feels like quite a heavy question for the first day of conference, but that feels quite pertinent.
Thank you. I'll take the question from the gentleman to your right.
Yeah, just to one point, this health problem is not just for the poor and the ethnic minority. I member of my family, who is, I wouldn't say was poor, but is now moving to Cornwall because she cannot live in London anymore because of the pollution. I used to work in Marylebone, and I know exactly how bad that is. However, the problem is that the government needs to, I think, would you not agree the government needs to move quickly to make public transport greener as fast as possible? And also, the poor and all of the people have a responsibility, because the minute you try and impose restrictions on cars and say, well, we have electric cars, big shout for, what are the poor going to do? So I think we all have a responsibility and a part to play in this. And what would you think should be done about it? I'd also like to hear some solutions from you guys, because at the moment, all you've given me is the problem.
Yeah, I'll take another question from the front here.
Elliot Hammer from Muswell Hill and Horsey Green Conservative Association. Maybe we can all agree on the problem. Very quick, very easy question for you. Is the solution technology, and is the best solution electric cars?
Okay, so the first question from Sean about your reaction to the health disparities white paper being delayed and your expectations from the government. Rosamund, would you like to take that question?
We can put it off, but there will be a tipping point, as people become iller. And just to say that before COVID, the waiting list was 4.8 million. And I don't know how long we're going to keep on putting this problem off. And I can just quickly add in there that no electric vehicles because of brake and tyre wear, that's not really going to work. Look, I think part of the solution, as someone said up there, some solution, my problem would be to ask the government, the advertising regarding cars may be very similar to the tobacco. They need to have a look at that. They're never going to do that. Most of my asks are not going to pass. The solutions are really difficult. Look, we have 38 million cars in the UK, and we are obsessed with cars. We've told this is aspirational. So how do you turn that round and say these cars or this construction is actually killing us. That is a government job. That is legislation. But if they're parking it, I am concerned, and I'll continue to raise it. All that means is people are going to continue to die until we tackle this. We can't get away from it, by the way. It kills me to say this, that people are going to die prematurely, unnecessary. So we either tackle it now, we start, or later. I don't really have a solution. He's the MP, and you would need to ask him about it. I can raise it with the government. I can raise it with the public. But ultimately, the solutions, by the way, they're not all easy, and governments don't like to be unpopular. And deep down, I feel governments are about short-termism, winning an election, and public health is very low on that. I mean, he can tell me I am wrong, and I'm quite happy to apologise and accept that. But from where I'm sitting, that's what it's like. It's like, how are we going to win the election in 2024? Oh, the fact we've got, a cancer sort of, list. I just don't think that's the priority. Maybe I'm wrong, and he can tell me I am wrong about that. I think public health is very low. Sorry.
Alexander, would you like to come in on that?
Yeah, definitely. For the second two gentlemen, is technology the answer? 100%, of course it is. And let's put this in perspective. We are living longer. We are living healthier lives than we ever have in this country. Yes, people are dying prematurely from air pollution. Of course they are, and that is absolutely disgraceful. However, compared to what it was even in the 50s or 60s, everyone here around the room looks very young and very nubile, but think about the smog in the 50s, which killed thousands of Londoners. We do not get that anymore. Why? Because we're closing our coal power stations. My seat, Rother Valley, had 6-7 different pits in it. People who worked in those pits got horrific lung diseases from the air pollution, from the work in those mines. People are no longer dying from those jobs. People are no longer dying from the coal power stations. So we are moving to a greener, cleaner energy. And you mentioned the 38 million cars. I have no issue with 38, 40, 50, 100 million cars in this country, as long as they're green cars, which are not polluting from the environment. So technology is the answer. We need to get from A to B. I'm the father of 2 young children. I cannot get even short distances, frankly, without a car. The public transport services are not good enough. And when they are in this country, they're on diesel power. Where are hydrogen buses? We need to get those improved. Take yesterday in point. I got a diesel-powered bus from London to Birmingham, which took me 4 hours, rather than the green, clean electric train, because the train's on strike. So the point where we're all playing our part, yesterday people were on strike, so I actually had to pollute and prematurely add health impacts because I got a 4-hour bus from London to Birmingham, which is no distance whatsoever. So if we all had to play our part, we have to look at technology. We shouldn't be putting people on dirty great buses to go 100 miles when there's a nice, good, clean, relatively green train from London. But when I say technology, it's not just about cars. There's also natural technology. What do you call it? Trees. Trees are the best things out there to clean our air. Not only do they provide oxygen, they also take particulate matter out of the air and clean it. If we are conquering over so many green swathes, and part of this is the government, of course, but part of it also homeowners who want to, concrete over their gardens, or councils who want to put a new concrete X or Y, we should be putting more trees to naturally clean the air as well, which we should be doing in green spaces. So we all have responsibilities. And one thing I want to be careful is careful of people who think they know the solutions to this. Because if you go back to maybe 15 years ago on the Labour government, where the big push because of climate change to get us out of petrol cars and put us into diesel cars. I would say that's one of the biggest public health scandals since the Middle Age, because we're getting people out of climate change, out of petrol cars into diesel cars, which are far, far worse for the environment. So now you've got a lot of people, understandably, who paid good money for a car, their vans, whatever, because the government gave them subsidies to go in far dangerous vehicles, which now they don't want to give up because they're quite expensive. We pay people to pollute our environment. That is one of those biggest scandals, and I think we need to hammer home whoever made that decision, whether the scientists or politicians at the time who said this was a good idea, they should be almost up in court for damaging people's livelihoods. Because trust me, a lot more people would be alive today if that political decision hadn't been made back in the mid-2000s, and that is a national scandal, and I don't think we talk about that enough.
Sorry, can I just quickly say something about the diesel scandal? As my daughter died, I think it's within my rights. Look, David King is the scientist he's talking about. I genuinely, after sitting in court for 10 days, Alexander, I don't actually believe that the government at the time, by the way, I don't see this as a party political issue. I believe this is a political. I believe at the time they genuinely believed it was a solution for climate change. And I don't think the government at the time was in with the car manufacturers who were manipulating the data. So this could have happened to a Conservative government. It could have happened to anybody. They were told, David King was told, and I sat in the inquest, that these cars were cleaner and it was a solution for climate change. People in Germany, as you know, have gone to jail for this over Dieselgate. I don't know whether we can sit here and blame the Labour Party. That doesn't really get us anywhere. And I just have to add on about the smog figures. Look, at the moment, there are people in their 40s and 50s getting brain cancer. And they have found that particulate matter is in the brain. We heard from the gentleman over there about lung cancer. And you can fog all that off. There's all this, it's not going to happen to me. So it's not my problem until it is. And we can pretend. Guess what? We can pretend there are no health, you know, it is all fine. And, you know, it was back in back in 1952 and right now. Why are we sitting here then? Why are we talking about strokes, cardiovascular, diabetes, strokes? They've all been linked to air pollution. So we either accept air pollution contributes to these things or it doesn't. Why is Chris Whitty writing a report about the impacts of air pollution on health? So to sit there, when I look at how much my daughter suffered and how much people who got COVID, because they're all respiratory illnesses, it's a bit much to listen to you say, we are all much healthier now. Some people do live longer, but Grenfell showed us in that small part of Kensington, there's a disparity of 10 years between the haves and the have-nots. And I think we just need to be very careful. If you say to people, everything is okay, then people will think, why do I need to give up driving? And electric vehicles, all the scientists admit, not me, the scientists, you've got brake wear. That doesn't solve it. That's what they have said. And Frank, you can speak to Frank Kelly. Frank Kelly has come up with this and said, you have got tyre and brake wear. If we electrify everything, will there still be air pollution? Yes, there will be. We can't sit here and...
But it'll be less, though.
Yes, but will it stop people like my daughter becoming that ill? We don't know. That is the question. The people who are dying now, will that stop them? That's what I'm talking about. It is okay if you are healthy. 1.1 million children in this country have asthma. Every year 24 die. That's just asthma. There are other illnesses. So let's not fog them away and pretend we are all healthy. Nobody should be dying in 2020. We have the worst rate of asthma in all of Europe. So those that's the other side, which you don't hear. That's what's going on. So I'm not making it up. That's what the figures show. If you look at the death report in the UK, we are the worst. Apart from, Estonia. I apologise. Estonia has a worse death rate regarding asthma. We can't pretend that this has got nothing to do with air pollution and everything is all hunky-dory. No, we can't.
So thinking about the second question about what more needs to be done to tackle air pollution and thinking about solutions, Councillor Joe Porter, would you like to come in on that?
Yeah, I will, yeah. So just to address your question about EVs and about technology, I think both have got a very crucial role to play in this. So one thing that we've done in Staffordshire is the Area Aware Staffordshire campaign. The team have been going out into the town centres with an electric van to show the public how to use an electric vehicle and the benefits, and to kind of educate the public on, electric vehicles, because I think it's really important that you do that outreach work so the public can see how it operates. And they've set up these events for, for COP26. We had a big event in one of the town centres where we had a big CO2 balloon to demonstrate, CO2 in the atmosphere, and we had the electric vehicle, and it raised a lot of really good awareness. I think another key thing when it comes to technology is councils and businesses. We use a lot of large fleet vehicles, so it's not just about the public switching to electric vehicles. We also need large fleet vehicles to make that switch as well. So at my council, at Staffordshire Moorlands Council, one thing that we've done is we've started using a brand new biofuel mix, a hydrocarbonated vegetable oil mix, where We are one of just a few councils in the country that have completely rolled this out to all our council fleet vehicles. It's reduced the carbon emissions by 90%, and it's obviously improved air quality as well. And obviously we're trying to encourage other councils across the country to do that. We have trialled electric fleet vehicles for our waste. Unfortunately, the technology is not quite there yet to allow the fleet to go up hilly areas like us in the Peak District, and unfortunately it couldn't make half the journey around the district. So it's all right for towns and for urban areas, the electric vehicles, for waste collection, but it's not quite there yet for rural areas. One other thing that I think that hasn't been mentioned yet that I think is also crucial is active travel. So I think we've got to have more cycle lanes. So one thing that we've done in the Staffordshire Moorlands is we've used disused railway lines and we've turned them into really accessible cycle paths. So we've got one called the Biddulph line. So we've got like Biddulph Valley Way, which is a really good cycling route, so people can cycle from Biddulph into Stoke-on-Trent, our neighbouring area, and they can cycle to work. And we've also done a lot of work with the Canal and River Trust to make the canals towpaths more accessible to cyclists. So I think it's really important that we do some good work on active travel. And to go to Alex's point, it's also useful because people can then access nature. If they're going to canals and they're using cycle paths, they can access nature as well as travelling to work without having to always use a car.
Thank you. Kate, would you like to come in on
Yeah,
solutions?
just on solutions. I think first of all, there is a debate around electrification of cars. As Rosamund spoke to, there's brake and tyre wear are still associated with particulate matter. I think we don't want another Dieselgate. So as we move to electrification, the most that we can do is continue to monitor and really understand the impact that it will have on particulate matter. So I think we can learn from lessons of the past by making sure that any new technology we bring in, we do that proper monitoring evaluation. There's a huge set of technologies. It's not just about electric cars, electric vehicles. I echo Joe's point around the importance of fleets as well. So we've seen our local hospital moving to electric patient transport fleets, which means the areas around those local hospitals are cleaner and greener. We've also seen them encouraging their district nurses to get around by bike. And some of these district nurses have never cycled before in their whole entire lives, had a few lessons, and are now saying it's quicker to get to their patients, they don't have to carry heavy bags with them, it's cheaper for them, it's cheaper for the hospitals. So trying to look for where electrification does work, and when it doesn't work, looking for some of those active travel solutions. And then in terms of other solutions that we've seen work, there's a huge amount of work that that is more in the kind of software rather than the hardware space. So I've seen a couple of startups which work to monitor construction sites around their emissions and to highlight peaks in emissions from construction sites, which means that those can be controlled, that local authorities can better understand what pollution from those sites is actually like, but also that construction sites themselves can then control and work out, was there a particular driver that was idling, what was actually going on, what was leading to those emissions. So there's more and more technology coming out, and I think a lot of that should be encouraged, and we need to find places that will adopt those technologies. And I guess the last point is on active travel. I think we can polarize things by saying it's electrification versus active travel, that it has to be one or the other. We need to understand better what people's barriers to cycling and walking, especially in inner city areas, are. So some research that we funded last year showed that there was 60,000 people across London who were on the waiting list for a cycle hanger space. So one of those big green cycle hanger where you park your bike. 60,000 people across the whole of London. It's a huge number. And these people who are willing to pay for that space, they're willing to pay for that service. They weren't expecting it for free, but they couldn't get their local authorities to invest in that as quickly as they wanted to see. So I think we need to understand the barriers, because there are real tangible barriers which are stopping people from cycling, from walking, and we need to be able to kind of meet those demands. And there will be people who will always need a car. There will be many people who always need a car, and electric cars are an excellent solution for that.
I think we need to have a diesel scrappage scheme. What do you think? A nationwide diesel scrappage scheme? Because there are lots of people who do want to change, but can't actually afford it. And I do think we also need legislation to hold the government accountable when they don't reach. But I think a diesel scrappage scheme and more charging points. DFT tell me that by 2030 there will be a minimum of 300,000 charging points. Let's wait and see. But definitely a scrappage scheme, because lots of people say, I would really like to change my car, but I can't afford to do it. So I don't know whether the government or whether they are even going to consider that at all. You will have to ask them about that. So that's one solution, scrappage scheme.
Can I just make a point about electric vehicles?
Yeah, if you just wait for the microphone to reach you. Sam? Yeah.
Right. I was one of the ones who actually bought a diesel car after Gordon Brown mentioned it, and yes, and it was a very expensive car, and it's sitting in my garage at the moment as a paperweight. I've switched it to electric cars. Now, before I did some research on it. There are 3 points I'd make. First of all, it certainly is better than petrol or diesel because it doesn't have that. Now, in regards to your problem point with braking and tyres, these are the points I'd make. First of all and foremost, most of my, I drive on what's called a e-pedal, which basically means that we have kinetic braking, which actually regenerates and adds up to the battery, so that it's not actually wearing the brakes. So that happens quite a lot, especially in inner cities. And secondly, in regards to the tyre wear, you know, when I was driving my Jaguar, I'd be lucky to get 15,000 miles. In my electric car, I've done 30,000 miles, and the tyres are still good, so there is less tyre wear. So I think there needs to be some proper information for people, and not just, you know, things that have been thrown out. And as far as scientists are concerned, you know, for every one scientist that says one thing, there's another one that says something else. So we need proper, adequate information, and the government can and should do a lot more to actually make the thing greener, and it's also cheaper. Electric cars actually is costing me very little to drive it. I've driven to Birmingham today because I couldn't get the train like you. My only point now is, can I get an electric charging point to charge it up? But fortunately, I think I might just about limp home.
Thank you. I'll also take a question from the gentleman here at the front.
Thank you very much. I'd just like to actually echo, Councillor Simon Ball from Rotherham. I've been driving electric vehicles for 8-9 years now, so when he said about brake dust, I'm going to echo that, because I changed my brake pads, I think it was 86,000 miles, and there was still a quarter left on it. You don't use brakes as much on an electric vehicle because you coast in, you learn to drive differently. So what we're saying about also the energy, where we're talking about how much we depend on electricity for obviously an EV car, what you really want to push as a unit is a thing called a vehicle to grid technology. So you come with your car, you then plug it in, so when your house is needing the electricity at night time, your oven comes on, telly, heating, if you've got air source, heat pump, etc., it will then take it from the car itself, and then at night time, when there's a surplus of energy, it then recharges itself up when it's better for the environment. So it's a win-win. So as a group, I suggest that you should look into vehicle to grid technology and see if you can push it forward, because it actually enhances the need for EVs, and that's my point. So.
They do that in
They're doing it with Nissan Leafs.
Take the question from the gentleman behind.
Hello, yeah, my question is about clean air zones. So we're in this, supposedly we're in Birmingham's clean air zone now. I mean, you know, I guess it takes some of the most polluting vehicles off the road, but probably not the gentleman's diesel car. So my question is, you know, how important is the role of clean air zones, and do they need to go further, like perhaps the one in Oxford, where it's electric vehicles only, to have a big impact, or you know, or is something better than nothing?
I'll take a final question from the lady at the back.
Much. Apart from the kind of very clear moral case for tackling poor air quality, there's clearly a really strong economic case from kind of improving productivity and saving costs to the NHS and people living longer, healthier lives. But often the costs and the benefits sit within different government departments' budgets. So my question to the panel is, how can government at a national and a local level work better together to actually show the real economic benefit of actually tackling air pollution?
Okay, so for the first question about clean air zones, who would like to come in on that?
Look, I think I know why I've been asked about this, because, look, I have tried to speak to Imperial about this. I'm going to say it depends how it is implemented and what is done. Look, I am behind, and I am on record saying, okay, there's a camera here. I have said to the Mayor of London that he needs to extend the ULEZ across all of London then. You can't have some with it and some without it. And I know I got asked this because it was about the LTNs in my neighbourhood and this bizarre way that it's moved most of the traffic now onto the main road. I actually do ask scientists about these things. Look, you either have to be brave enough and implement these measures all across the board, or you are going to get what you have. And tinkering it here, tinkering it there, people are just not brave enough. And what I mean by I am apolitical on this, my point to Mayor Khan is do what's best for the public's health rather than be a party sort of issue. Apparently this will work if you roll it across the board rather than having boundaries here, stopping there. Apparently that's what the scientists tell me, and that's the reason why it is not working. And that's why at London at the moment, some of you will agree that some of our major roads are completely chock-a-block. And what's happened, I think, is that other cities have seen what has happened in London and they've just thought, we don't want this here. I think that's what's happened. Do you know what? There is no easy solution to this. And I think a lot of this is to do with our car dependency. Look, we are, even when it comes to cycling, I do admit we are fair weather cyclists in this country. We're not like other countries. And we need to make a decision as, you know, the country, what is more important to us. We know where the pollution's coming from. We know where the emissions, construction, cars. Are we prepared? Because we like our nice cars, let's be very honest about it, we do. We need to make a decision because apparently most people are willing to walk at least up to 2 miles. But right now that's not happening. Look, a bit like the smartphone, we were told that it would give us freedom. We were told cars are going to give us freedom. And I don't blame the public for this. Every time I switch on, the news or an advert in the evening, they're advertising more and more cars. And there's a reason why, because they know people are going to want it. So we need to make a decision. But we need to remember, though, the poorest don't actually have a car. And as much as we talk about EVs and things like that, they're never going to be able to afford it. And yet, they seem to get the brunt of it. We need to remember this. There are people right now who are scared about heating bills. They're not going to be able to afford an electric vehicle. And let's be very honest, those are the people that are suffering the brunt of the air pollution in this country via main roads. So let's not sit here and pretend that this EV revolution, everyone's involved, because we know that's not true. Especially when it is what heat or eat. They're not going to buy an electric vehicle, are they? So if you can change, and I'm going by your thing, then please do so, because you will be lessening the air pollution. But from what Stephen Holgate has told me, that is air pollution going to ever come to zero? And he should know. He's been doing this for over 40 years. You are right, you're shaking your head. The answer is no. But at least people's health will be better. So, yeah, we need to do everything we can.
Thinking about the second question about how national and local government can work together to improve air quality, considering the economic case for it. Alexander, would you like to come in on that?
That's the $1 million question, frankly, about every part of government, isn't it? And internally in government, one department takes away, the other one benefits. And the case in point, really, I always suppose not for this, is health and social care. Social care is devolved to local authorities, health is the national government, and the two are sort of interplayed anyway, and you can't get that to talk, let alone we're talking about something quite hard to contemplate, which is transport zones. What we need to do, though, is, I think the danger even on this panel of going this sort of ideological war against cars. I'm going to be quite honest and say I believe cars are one of the greatest drivers of social mobility in this country. The more people who have cars, especially in areas like mine, which is a relatively rural area, they can get jobs. They can better themselves. They can drive. The public transport is so bad, they can drive to get better jobs. 50 years ago, 30 years ago, 20 years, my constituency, people walk to work in the local pit. Now they drive to the nearest towns, so they have better quality jobs and more economic benefits, so they can afford the electric cars and the home improvements. So I say we shouldn't be fighting against cars. If you're disabled, if you've got young children, you need the cars to get around, to live your life. And I think some of the lines we're seeing, and someone mentioned the Oxford clean zone, if you look at it, the line for electric vehicles is literally 2 rows long. All it's doing is it's a virtual signalling. It's not actually doing, if it's 2 roads, literally 2 roads instead of Oxford, it's not making a blind bit of difference to any pollution. It's just a way to inconvenience people and say, look, we've got this zone because it's fashionable. You're not actually doing it by evidence. Likewise, talking about LTNs, low emission neighbourhoods in London, I think in other cities as well, we're seeing it's forcing cars and vehicles onto different parts of the road, increasing pollution in other areas. I've heard of stories of people who could, let's say, drive to the hospital, take 5 minutes, take a 20-minute detour. That's not better for the environment.
Your government brought
That's
that
not
in.
better for it.
Your government brought that in.
The government actually gave money for people to do a whole series of events. The local councils, goes back to local councils, chose where they do LTNs, cycle paths. So go back to the first question, it's up to the local councils to implement it, but it was the government that gave the funding, so they could have gone, and interesting to hear what Councillor Joe said about reusing old rail lines for bicycle lane. I think that's a really good way, because also it doesn't force cars off. It doesn't force cars to be gridlocked, and we're seeing this with some cycle lanes, which suddenly going from 2 lanes of traffic, which speed through transport, to 1 lane, which actually slows down and creates more pollution. So we're all about working hand in hand and looking at the sensible solutions. So we just have to take a pragmatic, sensible approach to all of this and realise when it comes to air pollution, vehicles are one aspect, but we have to look at the sort of the macro issues as well. And once again, I go back to what Hannah talked about, is those greening solutions, like planting the trees and naturally cleaning the air. We can do this technology. We can clean our power stations. We can, even with things like AdBlue for diesel. These things are actually making our technology greener the whole time. So I'm actually very optimistic about the way the future is going, because I believe our technology, whether it's man-made inventions or nature, we can actually do that. We know what the problem is. It's a huge problem, but now we can know what the answer is as well. But we also have to make sure everyone has a good life as well, and that's good quality jobs as well, so they can get a job, good access to healthcare as well, hospitals. People shouldn't be discriminated against about having that freedom. I don't think we should have a London-centric view. And I think often when we talk about transport, it's very London-centric, because London has a great tube network, bus network. You go to my seat, there aren't many buses. They're cutting buses. That is a problem. So people need the car, but they need a greener car. So we can't just say we're going to get rid of all sort of cars or try and reduce cars, because that's not going to practical.
Councillor Joe, would you like to come in on the question about local and national government working together?
Yeah, I mean, I agree with a lot of what Alex has just said. I mean, when it comes to things like, just to address the clean air zone question, I've worked in the environmental NGO sector for quite a long time, and I've heard all sorts of different opinions about clean air zones. Obviously, they have different stages. Some clean air zones go to quite an extreme sort of level. Some of them are milder than others. Obviously, in Oxford, they've gone very far with it, and I do find it hard to disagree with what Alex has just said. It does seem a lot like virtual signalling. It doesn't seem like it's going to make the impact that they're suggesting it will. I think clean air zones here in Birmingham, it has made a difference. I won't deny, if you look at the evidence, it has reduced air pollution, but it's about how you implement them. In a lot of cases, they're going to really hit businesses. SMEs, who make up 97% of all businesses, they're going to be hit particularly hard by clean air zones if we implement them across the board. We've got all the costs of the pandemic and the cost of living crisis, that's hit businesses really hard. The last thing we need to be doing is penalising our businesses. What we should be doing is trying to incentivise people, trying to work with people. You don't want to go hitting businesses when they're part of the solution. So one thing that we've done in Staffordshire is with the Air Aware Staffordshire campaign, what we've done is we've actually gone to the businesses. So in Leek, which was one of our key target areas for pollution, the Air Aware Staffordshire team have gone to 10 key businesses in Leek. And what they've done is they've done travel surveys, and they've come up with unique commitments to improving air quality with the employees. And I think that is part of the solution, working with the businesses, finding out how that business can reduce its air pollution. I mean, it's like we've got a massive cement factory called the Cllr Cement Works, in Staffordshire Moorlands, one of our biggest polluters. They're part of the solution. We've got to work with them to reduce all their CO2 emissions and reduce their air pollution. We've got to work with them on that. So they've switched from coal to these biofuel pellets, which are far better for the environment. I admit they're not perfect, but they're far better than coal. So we've got to work with these businesses on these different solutions. And just to comment briefly on the partnership between local and national government, I think that's absolutely crucial with this. But I think what we've got to do is we've got to do what I've just said before, and it goes back to what Alex was saying about his constituency, and suppose my area as well, Staffordshire Moorlands. That, you know, urban and rural areas are very different. You know, we're not all like London, we're not all like Manchester, you know, where they have, you know, these clean air zones. We've got to have solutions that work for those areas, and we've got to take people with us, because if you go down the path of penalising businesses, trying to hit people's pockets, you're going to turn people off. And what we've got to do is we've got to bring people with us on this journey. We've got to make things easy for people. We can't make it complicated. Otherwise, we're just not going to take people with us.
Thank you. Are there any more questions from the audience? Yeah.
Hi, I'm Adam Tranter. I'm the Cycling and Walking Commissioner in the West Midlands. I wanted to just mention that about the anti-car stuff. I think cars in rural areas are eminently sensible. In a lot of journeys, you know, I drive a car, I drive an electric car. It was the European CEO of Ford who was basically saying that the advent of electrified vehicles will help, but an e-traffic jam is still a traffic jam. And we have a stat that the Department for Transport say that road traffic can increase by 51% by 2050 because of the advent of electric vehicles, because they're cheaper to drive, people drive more, and that's just happened the same with carbon emissions. Actually, all the energy efficiency savings of cars have been outweighed by the fact that people are driving more, so there's been no benefit in carbon saving in road transport. I wanted to ask, given that accepting the rural argument, which I think is really valid, in Birmingham where I work, 25% of car journeys are under 1 mile. Can we agree that actually we need to use the best tool for the job when it comes to different modes of transport?
I'll take another question from the back.
Hi there, Ryan Shorthouse from Bright Blue. We've done quite a lot of work on air pollution at Bright Blue, and two things I wanted to ask. The first is around clean air zones. So my understanding of them is that local authorities, when they run them, cannot intentionally seek a profit from their administration. They might do by accident. But might it be a useful thing to allow them to do that and then use that surplus or profit to fund specific things like local diesel scrappage schemes or other measures that might support some of the poorest members of that community who rely on cars? So just a sort of creative thing that we've called for before, which panellists might be receptive to. The second thing is around EVs, and of course the upfront price is the biggest obstacle. As a lot of people on modest incomes get vehicles from the second-hand market, they don't buy new ones. Might it be worth thinking about the plug-in car grant or some subsidy being available to people to buy EVs from the second-hand market to support people on modest incomes?
Kate, would you like to come in on the second-hand market and subsidies to buy EVs?
Yes, I think that's a really interesting idea, Ryan, and I think we focus far too much on the upfront cost when actually, as you say, most people on lower incomes are buying from the second-hand market. I think there are other options of also looking at for people living on lower incomes, particularly around shared mobility, car sharing. There are other ways that they can get access to cars that at a lower cost. So just looking at the whole round of different ways that people can, as you say, get around. Everyone needs to get around. It's not about penalising people. It's not about making people's lives harder. It's about making people's lives easier and creating healthier, clean air. So I would definitely second the second-hand market point, but also look at other ways of doing shared mobility.
Yeah, Alexander.
On the second-hand market, completely agree. That's essential. I think my understanding though is it's the batteries that are the issue, and the technology isn't there really to recycle them so much. But over the years, that will get better. I've never bought a new car in my life. I bought one second-hand because I think it's ridiculous. We're not paying almost double the price for a new car when, even if it's a couple of years old, suddenly it works. So that's where we need to get involved. Your idea about you allowing councils to charge for clean air zone and then having to use that money to invest in scrappage, I think it's a great idea in principle. I think it's superb in principle. But then I look at a similar scheme which currently exists as Section 105 money for developers. So in that way, developers have to give a certain amount of money in an area to offset the impact of development. And I think anyone who's a councillor or has been a councillor knows that money isn't necessarily earmarked to that particular area, or the definition is so broad that many councils use it for their own pet projects. So if you do something like that, I think it had to be so clear what councils can use, because otherwise I fear they'll be frankly open to abuse. The gentleman, the cycling commissioner, thought they'd use the best tool for the job. Yes, every area would be different, and that's the last mile solutions are the big problems. And already in the panel we mentioned COVID. Rosamund mentioned how deaths decreased during COVID. The flip side of that during COVID is more people are getting deliveries, home deliveries in the vans everywhere. My parents, case in point, they're in their 70s now, they never got home deliveries, but now during COVID they realised they can buy everything online, and now they never go to the shops. So they get everything delivered because it's so easy and cheap. So actually there are increasing number of deliveries, far more than there ever were. So we just have to try and cut down that last mile solution with the sort of polluting vans. We have to solve that problem, because that's, I think, one of the problems which should be easy to solve and we're not solving.
I think just for me to end is that, yes, as much as cars give freedoms and we all like our freedom, that there is a price to pay. This sounds like we're talking about the tobacco. When I speak to doctors, it's like we've been here before. They see this as similar to the tobacco debate. And it's a shame there's not a medic on here, because they can give you the other side of the impact of air pollution. This ultimately, by the way, is about public health and about people dying prematurely. And Alexander, your views on there needs to be as many cars and everyone can jump in a car. There will be a price to pay, unfortunately, and people like my daughter end up paying with their life, unfortunately. And there are people who are terribly ill. And I think for me, I struggle with the fact that you've now got people in their 40s and 50s getting brain cancer and lung cancer, people that don't smoke. I struggle with that, but then that's because of the journey I have been on. And maybe most people don't care, but it does bother me. And one of your MPs died. I've been in touch with his family. He never smoked, and he got lung cancer. So I'm not just taking this. This is a very, very serious matter, and we need to take it seriously. So I am concerned. You say, yeah, we can all get in our cars and drives, and he's right. But there will be a price to pay, and we need to individually. We all need to make that, decision. What did someone say in Birmingham? Under a mile, so many people driving. Come on, a mile. We have an obesity issue in this country. Under a mile, surely we can walk. And no, I am not talking about people who are disabled, because my daughter was disabled. So that's not who I'm talking about. But under a mile, I think most people can walk. Do you know what? If we do nothing, I've said this, and we continue to go down this route, someone will say to me in 10 years' time, oh my God, you did say so. By then, it will be too late. And we're talking about real people dying. We're not talking about figures being made up. And that's all I'm asking people to just think about, that the people who are dying, they actually need not die, because it's premature death. That's what I'm saying on this matter. Joe?
I think I agree with what the person in the audience was saying about the best tool for the job for each area. I think each area is unique, but I think one issue that hasn't been mentioned yet with EVs that I should have raised earlier but didn't, in the Staffordshire Moorlands we haven't got as many charging points as I would like, and it's something that's on my list of things to sort out, but it's not quite as clear cut as getting a provider in, getting them installed. It's very complicated, because in a rural area you've obviously got a limited number of users. You've only got a small amount of users compared to a urban area, like a town centre. So in our town centres we are getting them installed in all our car parks, and obviously that's important. But in the Staffordshire Moorlands we're part of the Peak District, and we've got lots of rural villages. Some of them you get a lot of tourism, like people going on walking holidays, visiting the pubs. And the thing that I'm always conscious of is it's important for tourism to have EV charging points, because if someone visits an area like ours in Staffordshire Moorlands and they have an electric car, it kind of prevents them potentially coming to our area from a tourism point of view. I mean, we had a meeting with Alton Towers, who are one of our largest businesses in the Staffordshire Moorlands, the other day, and Alton Towers haven't got a single EV charging point in their main car park. And bear in mind, they are the largest theme park in the country, and they still don't have EV charge points. And I find it bizarre that that's not the case yet. So we're going to be working with them to try and obviously make that happen. So, you know, in rural areas, this is a huge challenge, getting the charging point infrastructure in place, because it's difficult to get the market working so that you can actually get them in place. But we are going to need them. You know, we're going to have to work with pubs, you know, and village halls and churches to try and get them in those car parks. You know, it's not going to be easy to do that, and this is why I think, you know, the active travel stuff is also important too. Obviously, we said about cars, and yeah, to an extent, I do see what Alex is saying. You know, cars are essential for people in rural areas. You know, in my village, my ward, people won't be able to get to their jobs without cars, but we've also got to have the active travel for short journeys. And also, I think we need more train lines, because in my area, because of the beaching cuts, one of the old railway lines, the Leek to Stoke line, got abolished years ago. We're trying to get that reopened in Stoke and Staffordshire Moorlands, so that people can use train journeys instead of getting in their cars, and then that'll take more cars and fleet off the road. So I think we haven't really mentioned trains, but I think we could do with more trains. You know, in particular areas like mine, it'd be good to have train service, because we're one of the few districts in the country that doesn't have a train station, and it'd be really nice to have one.
Well, thank you everyone for all your questions. I'm afraid I'm going to have to wrap up now. Bright Blue actually have an ongoing research project about how to reduce air pollution in a socially just way, which we're looking to publish in early 2023, so if you're interested, keep an eye out for that. I would like to thank Impact on Urban Health for partnering with Bright Blue for this Fringe event, and I would also like to thank the panellists for your time and for speaking at this event. You are welcome to remain in the room after the event finishes to mingle, and you can sign up to become a member of Bright Blue by speaking to any of the Bright Blue team here today. We have an exclusive discounted offer of £10 for membership if you join during Party Conference. And we are hosting a lot of Fringe events throughout Party Conference, so please have a look at the flyers on your chairs and take them away with you. Our next Fringe event is happening in this room in half an hour and includes Paul Scully MP and Dehenna Davison, which will be talking about transformational times, making levelling up felt by local communities. So thank you all for coming, and we hope to see you there.